threat, especially in our continent. One of the key reasons is that there was no sustainable mechanisms to follow up on the commitments named then, and the targets set were not specific and measurable. The accountability language that was used in the resolutions made then was also very weak, and key stakeholders such as civil society and the youth were not engaged. This time, we have to do things differently, and we the youth stand up to be counted.
For key ask for the UN General Assembly, as you may know, youth, we clamor for our voices to be heard. Most importantly, the African youth. We want to make sure that the agenda, the global agenda for AMR, reflect the African continent reality, and to ensure that during the deliberations, the AMR priorities, the certain AMR priorities are tailored towards African continent issues, and also we have to make sure that we identify areas where youth can also engage and make sure that these areas can be built upon, we can build upon this certainty. So for me, I would say the UN General Assembly deliberations must ensure that the youth voices are acknowledged, are respected, and also must be reflected in the resolutions and the outcomes of the UN General Assembly.
My major expectations for the United Nations General Assembly on AMR, a key one I would say is increased efforts towards resource mobilization in AMR advocacy, because without resources, you can't really kickstart any campaign. You can't really implement any campaigns. So I would say increasing efforts towards resource mobilization for AMR advocacy.
We need representation from various high-level meetings so that we can actually contribute our thinking towards the various agendas that have been brought up by the various discussion platforms in various organizations. So those are the areas that we need support and also attention.
The General Assembly can be able to reaffirm the commitments of the countries. They can call the countries to reaffirm their commitments towards engaging youths in matters AMR. Youths should be engaged in the policy development, in the actualization of the policy development, and this can go a long way in averting the AMR crisis.
We're looking at drafting a joint African youth position statement on the upcoming UN General Assembly on the high-level meeting on antimicrobial resistance. This will ensure that the voices and perspectives of African youth is effectively represented in global discussions on antimicrobial resistance.
I'm so glad that this is happening at a very critical juncture when we are gearing towards the United Nations General Assembly high-level meeting on antimicrobial resistance. So Africa CDC has started consultative meetings, series of consultative meetings to discuss the position of Africa in regards to antimicrobial resistance, on what is going to drive the conversations at the high-level meeting in September. So one thing that we have observed is the missing of the youth voices. I'm so glad that right now they are working on a position paper, which we are going to review, and then Africa CDC will come in and see how we can best support the voices of youth in antimicrobial resistance, and how we are going to incorporate them in decision-making discussions.
Efforts to mitigate antimicrobial resistance have progressed at a very slow rate in the couple of years, while the burden of antimicrobial resistance continues to grow significantly. It is time for our governments and other major stakeholders to rise to action. It is time to do things differently. The youth will be here to hold you to account.
Hello, hi everyone. Welcome to today's session. It's great to have you all on board. Thank you so much, everyone, for joining today. We are really humbled by the overwhelming presence. Currently, we are at almost 8 people, but I'm sure as we go on, we'll have others joining us as we continue. Also, if you have some colleagues who are yet to join, you can just share with them a reminder. It's on a weekend, so some people might have forgotten to join in to the session. So thanks so much for joining. I want to just give a brief overview of what the webinar is about. So today we are launching the African Youth Position Statement on AMR, which is a consultative document that was developed by 14 youth-led organizations in the African continent, and the process was also open, whereby we had quite some Google form go out and us collating ideas of what different youths would love to, address in that position paper. And it addresses, our challenges as a continent, as Africa, and also our challenges as the young people. With me today, I have colleagues, members, executive members of the African Youth AMR Alliance Task Force. Some of them are here in the panelists. You can see them. I think we'll get to know them as we go on. And I have also my colleagues from React Africa. That's our Deputy Director, Julian Nyampatitu, and our Director, Professor Marvin Mukundu. So React Africa has been very instrumental in terms of collating and bringing together different youth organizations in the African continent. And this because we need to work together, we need to sync our energies together so that at least, what each one of us is, the little each one of us is able to do on our end, we can join this up and, have magnify our voice, especially at the global level, at the regional level, and also at our country level. So I'll just take this moment to welcome our Director of React, Dr. Professor Marvin Mukundu, just to share a few words, and then we'll continue with the program. Thanks so much and welcome, Prof. Over to you.
Greetings, everyone. Thank you for giving me an opportunity just to say a few things concerning the United Nations General Assembly high-level meeting and what your contributions have. It's been great to see that you have worked very hard over the last several months to come up with what you consider high issues. You recommend that the United Nations take on, they deliberate around the issue of AMR. One of the things that's very clear and concerning is that AMR reaction towards the way that we have reacted towards the Global Action Plan and the implementation of national action plans, we are not where we should be. The implementation has been quite slow. There hasn't been much commitment towards funding. There haven't been much commitment towards taking a One Health approach. We still have challenges in terms of access to diagnostics, access to antibiotics, access to other technologies that will aid in mitigating antimicrobial resistance. We still are challenged with trying to break down the language and the semantics around AMR. So it is, and then of course, the youth have been left out quite a lot in the past, where they have not been able to contribute to these processes. These are going to be very, very high, very important conversations at the UNGA in September, and the seriousness of the process is there are lots of consultative meetings that are taking place now that are feeding into the discussions, and that will feed into the final resolutions and recommendations that are going to come out of the General Assembly high-level meeting. The high-level meeting aims to secure strong political commitment and accelerated action across all sectors and at all levels to address the urgent threat of antimicrobial resistance. The expectation is that the UN high-level meeting on AMR will be able to conclude with a concise and action-oriented political declaration that goes beyond the 2016 declaration, including defining the targets, spelling out mechanisms for accountability, and setting a politically defined vision to provide clear direction and accelerate the global response to AMR. So it is with this that your contribution towards this process is greatly appreciated, and continue to be the voice, continue to be active in the space, there is a lot that you can do. You have the answer for today and you have the answer for tomorrow. So I congratulate you and wish you all the best. And also wish you all the best as you deliberate and encourage you to continue working so we can be able to address this issue and we can create a world where you and I, our neighbors, our friends, our children, our grandchildren, will have no fear of getting any untreatable infections, knowing that we will have solutions for that, that would have a collaborative effort in ensuring that we slow down the progress of the AMR. We are able to ensure equitable access to all diagnostics, novel antibiotics, and and old antibiotics. And so your voice is important, and your recommendations that are being launched today are really, really important and timely because they come in at a time when conversations are going on. With that, wishing you the very best and congratulating you. Thank you.
Thank you. Thanks so much, Professor Muffin, for being with us today. And also, I know you have quite a busy schedule today. Thank you so much for taking the time. We do appreciate, and it's always wonderful to hear your words of counsel. So, guys, we have a Q&A session. So in case you have any question as we continue or any contribution, please feel free to share through the Q&A session. We'll have my colleagues Michelle and Nahashon just going through and noting the key questions. We'll have an opportunity to address any questions. So please feel free to share any question. We may not be able to monitor the chat because of the, there are a lot of introductions happening, which are also very good. We'll also have a Mentimeter session, also just to collate, further ideas. So we'll have a session for that, further ideas that you can also, add in and synthesize with the current position statement in case you are not able to provide some, some feedback before. And so with that, I would like to welcome our Deputy Director for React Africa, Julian Nyamupachitu, and she will take us through an overview. I know some of us might be wondering what is this UNGA high-level meeting that we are talking about, and why is it important? So Julian will take us through all that, so that at least right from the start we have a good understanding of what is this meeting and why is it important, and why we as the youth need to actually be actively involved. Thank you so much, and over to you, Julian.
Thank you so much, Daniel, for that. And indeed, it's a great day. Always encouraging when I see the youth champions joining, making time this evening. I think it's evening, afternoon for most of us in Africa, and I saw quite a number of countries represented in the chat, so that's quite encouraging and welcome. So my role now for this session is just really to give an overview of the United Nations General Assembly. What is this? What is this high-level meeting on AMR for 2024? Just a background of how this came to be and what it is. So the United Nations high-level meeting is convened actually under the UN General Assembly, or UNGA, which is the main, which is actually the main convening body for the United Nations member states. It's actually the main decision body for the United Nations. So in this forum now, that actually happens yearly, member states discuss and work together on a wide variety of issues that they agree to discuss on. So these are issues that are decided upon using the UN Charter. The Charter is a document that defines actually the rules for admission of member states. Membership is actually open to all states which accept certain terms that are under the UN Charter. So the UN General Assembly actually constitutes 193 countries, which is actually the whole globe in a sense. All the African countries, the 54 of them, actually constitutes this UN General Assembly. And the agreement to hold a dedicated high-level meeting on a specialized topic is actually taken through a resolution. So the UN member states decide, so what are the current challenges that the countries are facing? Which are the top global health threats that are there that need to be addressed, that warrant that such a high-level discussion come to play, where, as I said, this General Assembly actually has 193 countries that come together to discuss issues that they agree on. So as I said, that the main aim is actually to deliberate on policy and then come up with a resolution, as I think Professor Meffin mentioned, that the key output of this UN General Assembly is actually to come up with a political declaration. And it's a very big forum, you can imagine, where representation of all these member states actually gather and discuss. So some of the functions and powers that they have is actually to oversee the UN budget, and they actually appoint members to the Security Council and also the Secretary General of the UN, and also make recommendations for the General Assembly, including, as I said, coming up with which are the global issues that are that's actually affecting member states and how are they now discussed at this high-level meeting. So they actually meet the third Tuesday of September, and it actually lasts for several weeks. And when they meet, they discuss the specific global health challenge that will be been agreed in the resolution. And there'll be world leaders, UN officials, and representatives from different sectors to actually deliberate on the action plans and initiatives, coming up with targets or actionable steps that come up from these deliberations. So it's actually a very big platform that serves member states to express their views, forge alliances, and collaboratively work towards solutions for different global issues. And it plays a critical role in international norm setting and the coordination of global efforts for peace and development. So you can imagine even the photos that you see there, like the one at the bottom, just look at the sheer number of people that are there trying to come up with resolution, something that makes sense to address the global health threats. If you look at, say, a global health challenge like AMR, for example, that we know affects the globe, but now the African region and the low and medium income countries are actually affected more. They actually have unique challenges that are there. And now the challenge here is to ensure that our voice from the African region, our voice from the LMICs is actually put there so that our unique challenges are addressed. And it becomes such a challenge because it's competing interests with the global north and then the global south coming in with different challenges. And the fact that it's, as I said, the 193 member states makes it even more complicated. So there are special sessions that are within the Assembly to focus on these issues. And the major objectives, just to summarize them in other words, is to say to mobilize international action on critical topics such as health, climate change, which has really become an issue. I'm sure we are even living it as we speak because there's a lot of the effects of climate change that we feel. Like here where I'm resident in Kenya, we just had some flash floods coming into play. And you know what that means for a global health challenge like AMR, where already we've got a burden for infectious diseases. And you can imagine now that there are floods, people have lost housing, that only makes it worse for the spread of infectious diseases. And then obviously then also the AMR is obviously propagated in such an issue. So such as the climate change, sustainable development, and then peace and security. Looking at just the general, the global sustainable development goals that are the goal to achieve a lot of targets by 2030, you'll agree with me that still we have a number of gaps, particularly in the African region. We have managed to achieve, of course, a bit of some of the targets from these SDGs, but currently there are a lot of gaps that are there and time has run fast. It's just shy of 5 years for us to have met most of the targets. So such forums are really important for member states to reflect on all those developmental targets,
look at where the gaps are. Look at now the emerging global health threats such as AMR, that's even the World Health Organization has confirmed that it's actually one of the top global, 10 global health threats. So the significance of this United Nations General Assembly is that it demonstrates the power of having different countries come together, multilateralism, where there are a lot of countries coming from different parts of the world, and a platform where we are trying to seek consensus building, negotiation, as I said, where there are different competing interests based on the geographical region and the establishment of global norms. So what are the health-related United Nations high-level meetings that have happened historically? So quite a number have taken place, right from the slide that I show here says since 2001, there's actually been 10 high-level health-related political events that have happened. As I said in my previous slides, that this looks at all challenges, not just health, but then all the challenges that are facing the member states are brought to the table. And for now, AMR, with the way I think as Professor Merfin said earlier, that it doesn't have a face. That's one of the challenges that AMR has. Unlike such some of the health issues like HIV, TB, where people can relate, sometimes AMR tends not to be relatable. So we should really be happy that 2024, it actually made it to be part of, to be on the agenda for the high-level meeting. So you'll notice that for HIV/AIDS, for example, it has been debated on 2001, 2006, where of course that's where it was really a global health challenge. And before, of course, the ARVs became effective, etc. 2011, 2016, HIV/AIDS was on the table. NCDs, which are becoming really a global health threat across different regions of the globe. There was a high-level meeting in 2011, 2014, and also 2018 looking at NCDs. AMR was actually deliberated upon at a high-level meeting in 2016, as we mentioned at the start, and was said even in the short video we played at the start of this session. So following on from that, as you're all aware that the Global Action Plan came into being 2015. So there was then now momentum that started being built, and 2016 is when now the high-level meeting was actually brought onto the table for member states to actually deliberate on AMR, acknowledging the fact that it is a global health threat. In 2018, it was actually TB, and 2019, universal health coverage. And in 2023, actually, it was a three-tier meeting that actually involved looking at TB, universal health coverage, and also pandemic preparedness, just from the lessons learned from COVID-19, that really had the global community acknowledging the fact that really we are not prepared for pandemics. So what can be done as a global community to ensure that when the next pandemic happens, we are actually prepared? And you agree with me that we always say, as the people who understand that AMR is a global health threat, we always say that this is indeed a pandemic that is ravaging, that is not a silent tsunami, but actually here with us. So it is really encouraging to hear that this is happening later in the year. And from all these meetings, from the different health issues, what actually comes out of it is the output that is the political declaration or political statement. And it always starts with what you see in yellow there. We, the heads of state and government and representatives of the states and governments, assembled at the UN headquarters in New York, which they do in September on this date, and we have agreed to the following. So now they agree to those, they try and set targets so that member states now use that as actions that they can actually address at their level when they come to the countries. So just looking at a roadmap of how now after the UNGA high-level meeting in 2016, of course, there have been milestones achieved, but a lot of challenges still to be actually dealt with even following this, but at least a number of milestones were achieved because looking at 2014, that is when there was the first ministerial conference on AMR, where it was actually established that antimicrobial resistance is really indeed a global health challenge. That warranted that a global action plan actually comes into being. Because as you know, if you don't plan for anything, it even continues to be a problem. So it was agreed upon that a global action plan needed to be put in place. And following on that, now there was a UN General Assembly, now political declaration, coming out of the UNGA high-level meeting in 2016, as we have said. So this was also endorsed by including the then tripartite, which was constituted by WHO, FAO, and then OIE, that is now WOA, the World Organization for Animal Health. So in 2017, following on from that, because of course there had been a bit of political momentum put around AMR following this high-level meeting, an interagency coordination group was actually established. This is a group with some of the members you see actually in this photo here at the center. And it was a multi-sectorial, multidisciplinary group that came together to see how best REACT was actually represented in this group as well, to try and come up with targets, try and come out with resolutions of how now with that political declaration of 2016, how it can actually be put into place practically. So in 2018, the quadripartite members came together to also build a strong focus on this AMR using a One Health context. And in 2019, the IACG launched the reports with recommendations in April 2019. So these were recommendations that were building up from the 2016 political declaration, building on from even now the fact that the quadripartite had realized that we have to work together using a One Health approach. So how can all this come as recommendations of what needs to be done? And there was also a second ministerial conference on AMR. And then in 2020, Global Leaders Group was actually established with the same mandate so that at least the political momentum would have continued. I see there's a hand raised. I don't know whether if it's a question we can address after the presentation or if it's something that we can put in the chat. I'll pause to hear if it's something that maybe there's an issue or maybe you can't hear me.
Yeah, we can hear you, Julian. Maybe for the
Great.
question
So,
for now, just to not interrupt our speakers, maybe we can have them in the
okay.
Q&A session. Then maybe you can have them being answered after the presentations. Thank you. You can continue.
Great. I just thought the end was maybe I'm not audible or something. So in 2021, there was a high-level dialogue on AMR with a call to action that was also that was put in place. And in 2022, what then happened when this UN, the quadripartite, the then tripartite came together, the environmental sector was not really actively involved in this. But in 2022, UNEP joined FAO, WHO, and WOA to form the quadripartite. And also the third ministerial conference on AMR was actually established. So these are really great milestones that show that at least there is recognition that AMR is a multi-sectorial problem that warrants that different players work together, right from the global space. And of course, this then comes down to the regional and then to the national level, where the One Health approach is what is being actually the way to go, looking at the fact that AMR actually cuts across different sectors. So where we are now, following on from that, is that now we are looking at now the UN General Assembly high-level meeting that will happen in 2024. And this will look at specifically antimicrobial resistance, looking at how all these political commitments can be further refined, what is missing from, say, the political declaration of 2016. One of the glaring missing things there was that there was no mention of the civil society or community or the youth. And yet you can imagine even in our context that even awareness levels for antimicrobial resistance are actually lowest at the community level. And the CSOs, these civil society organizations, have a very big role to play in trying to at least empower communities, educate communities hold the governments accountable as well to all these commitments. Because if the commitments are done, but if there is no action moving on from there, then it becomes a challenge. Because even in 2015, when the Global Action Plan was put in place, all countries were mandated to come up with their national action plans. So, for example, here in Africa, WHO Afro actually confirmed at the start of this year that all the African countries in the WHO Afro region now have national action plans in place. But these policy documents are really mostly on paper. Implementation becomes a challenge. I'm sure even yourselves as youth champions, we have tried to follow through with your national action plans that have the 5 focus areas looking at awareness, the antimicrobial stewardship, infection prevention and control, research, and all. You agree that there are a lot of gaps that are there. There are a lot of gaps in the actual implementation. So it is important that, of course, the policy documents focus on the gaps, focus on real political commitments with refined targets. But at the same time, we also need the communities, the civil society to actually hold the governments accountable. So this will take place in September, as I said, this year. And this one now, this slide is just further summarizing what I was just talking about, looking at that high-level meeting that happened in 2016, that had a political declaration that was adopted. It was recognizing that it has impact on health, food security, and development. And also, it was only the 4th time a health issue was taken up at the UN General Assembly. It was preceded by HIV, NCDs, and Ebola. That was in 2016. And the heads of states committed to a coordinated approach across the multiple sectors. That's why you see even the quadripartite also work together, coming out from these recommendations. Countries also pledged to develop national action plans based on the Global Action Plan, mirroring those 5 objectives under the Global Action Plan. Increased international cooperation and also funding, and then regulation issues around antimicrobials, awareness promotion, and also innovative approaches. So this photo is just showing some of the delegates that were there during this 71st session. So looking at the one that is happening this year in September, the Global Leaders Group that I talked about, that was put in place to actually look at how AMR can be addressed right from the global level and narrowing down now to the regional and country level. So some of the suggestions for consideration that the Global Leaders Group have put across, this of course being, it's actually informed by the challenges coming from the different regions. The first one being financing. A global financing instrument and domestic resource allocation mechanism need to be put in place. This is a real key challenge in the work that REACT has been doing here in the African region. Each time we ask, one of the major challenges that countries face in trying to actualize their national action plans, one of the key gaps and the key challenges that we always get is the financing, where of course, even at the national level, where there are a lot of competing interests, you can imagine there are a lot of problems that the policymakers have to deal with. Narrowing down to health, where you look at now COVID-19, which was a challenge a few years ago, HIV, which has been a challenge since a long time ago, malaria, and a lot of other challenges that keep coming, Ebola, etc. And now to ensure that AMR gets also allocation in the resource allocation becomes a really big problem. Even at the global level, having now dedicated funding that is there for antimicrobial resistance is also a challenge. Accountable governance. This is also a key challenge, looking at the governance structures right from the global level, now coming to the national level, there is need for accountable governments where people are held accountable to these commitments they actually signed for. When you come out with a national action plan, what commitments are we having to ensure that the whatever has been tabulated there is actually put into place? Surveillance for action, transformed systems, environment as well, looking at also climate change issues, AMR and pandemic preparedness and response, which I actually talked about, which COVID-19 helped to actually have countries accepting that they were not prepared for pandemics. And also targets, very important to have. because without targets, you won't know how to measure progress. You won't know how to reflect and see whether any progress has been achieved. So this slide is just summarizing some of the suggestions that the Global Leaders Group came up with how to feed into now UNGA 2024. So looking from the African perspectives, just based on the challenges that we have, the unique challenges we have, there is need for renewed political will, definitely, so that at least policymakers know that it is important to actually commit to the political statements that will have been put in place, including the national action plans. Investments in health, very important. Africa has challenges in weak health systems. So just also moving on to addressing the social determinants of the infectious diseases themselves. Because in Africa, we do have unique challenges. I talked of just, of course, the external things like floods that come to play. But even just the access to water and sanitation is a key challenge that actually propagates these infectious diseases in Africa. So these social determinants of infectious diseases need to be addressed. They need to actually form what is part of the priorities for member states. Financing for AMR action plans, I talked about, that is the key challenge that we need to have sustainable resource mobilization strategies. We need to see how even the utilization of resources is done in an efficient and effective way. Sustaining also partnerships, the public-private partnerships, and also partnerships with the global North and the global South. And access to essential medicines and optimal use, a key challenge. Looking at even regulation of these antimicrobials in Africa is a very key challenge, because it's not just the misuse of antimicrobials in Africa, but even the access to them, because people do not afford healthcare. People do not afford to go to the health facilities. So now there is need to ensure that there is access to essential and effective antimicrobials, and also that they are used in an optimal way. Strengthening health systems, preventing infections and spread of AMR, and also generating and sharing local data, very important. Because if we don't have data, if we don't have evidence, then there's very little we can do to even try and advocate to the policymakers, because they'll ask you, okay, you have said AMR is a challenge in Nigeria. Show me the figures that back up whatever you're saying. So we should ensure that we continue generating and sharing local data. As the youth, it's one thing that we can actually help doing by doing more research, contextualizing solutions. Sometimes the solutions that come from the global north do not necessarily relate to what the key challenges or the priority challenges in this global south are, especially when you look at the social determinants of the infectious diseases. Verifiable indicators to measure progress are also very good, and supporting community engagement. So as I come to almost the conclusion of my presentation, what is a general guide of what the young people can do? What can you people do? The fact that you're actually here today speaks volumes, because you are here to launch this position statement that speaks to your voices. And as Daniel has said in the beginning, we also have a Mentimeter that speaks to what are you saying from a personal level that can be actually captured. And there's an option to either share your name and institution, or you can just put it as an anonymous submission. That is good. And we can also see how best we can also ensure that those voices come to the highest level. As Professor Murphy has said, this is timely because the conversations are actually going on. So the first one is that it is important to participate in discussions and events to contribute to perspectives on AMR. So these pre-high-level meeting dialogues and events, make sure you attend as much as you can. I think one of the panelists we have here, Lucy Gatito, was actually speaking on a platform that was there just earlier this week, where it was the multi-stakeholder partnership platform. This is a platform that has been put together by the quadripartite, recognizing the fact that AMR is a multi-sectorial problem. So it brings together different members from different sectors. So she was actually sharing also the voices of the youth in that platform. And it's important to contribute in such platforms. Engaging with the CSOs working on AMR for advocacy and learning, very important. The CSOs have got the experience to actually hold governments accountable. And it's important as the youth that we identify the CSOs that are working in our country, in our regions, in just our communities, and see how best to leverage efforts and work together with them. Contribute knowledge to One Health approaches, including integrating the different sectors so that there's a multi-sectorial collaboration is also a good thing to do. Social media and digital advocacy. You are the gurus or the best people in handling the social media, the digital developments that are happening. How do we utilize artificial intelligence? How do we utilize the social media platform? How do we utilize X? How do we utilize Facebook, Instagram, Twitter, the other ones I don't even know, TikTok, etc., to actually share information, engage in campaigns, try to come up with podcasts. You don't know where it will end up. Maybe whatever you're saying is the very best decision that the member states, as they gather, they'll be able to at least know this can work since we have failed. How can we best do it through the innovative approaches coming from the youth? The side events that are related to UNGA as well. The workshop, the forums around the high-level meeting for broader participation are always good to actually engage in. And what we'll continue doing as well is also share, even with this group, whenever we hear that there's a convening for just the UNGA high-level meeting, we also share with you so that you come in, contribute as the young, the youth that are always left out usually, and that we left out even in the 2016 political declaration. So you can see how best now to contribute and make sure your voice is heard. Participate in simulations and engage with other academic institutions and youth networks. There's always power in convening as a network to actually do this. I'll conclude by saying that we should not forget that Africa's greatest resource is in its youthful population. We are actually the continent that has the youngest population in terms of the demographic. Our demographic pyramid shows that it's actually very wide at the bottom. We do have a lot of youth. So your voices, ideas, and actions actually play a pivotal role in shaping the future of public health. It is essential that we stand up, speak out, and take the lead in paving the way forwards towards a healthier and more resilient Africa. I actually urge you to contribute, as I have said, to influence the political declaration that's going to come out of this high-level meeting this year. And you can start by signing the African Youth Position Statement if you have not already done so. The next session, of course, will focus on now looking at what the African Youth Position Statement has. What does it have in the different, in the summary that has been brought up by the voices that have come from you? You sign on to it, because the more youth-led organizations that sign up to this position statement, the better, because it actually shows that right from not only the Anglophone, even the Francophone, the Lusophone region of Africa, all the youth are coming together to say, you know what, this is what we feel should happen, because you own the future anyway. So work together to make a positive impact and combat this global health threat effectively. It is important that we work together. So there is this Mentimeter that we would want to collect more voices, as Daniel has said. I think he will share the link later in the chat, so that feel free to at least put your voice forward, and then at least apart from the statement that we do have, this one, the position statement, it will be also important to hear from a personal level from whatever is coming from Nigeria, from Tanzania, from Zambia, from Zimbabwe, all the countries represented here. What do you as an individual think of this? How do we change what we have failed to do? Looking at your experience working with antimicrobial resistance that we recognize is affecting the African region even more. So thank you so much. And I'll hand over back to Daniel to take us through the next session, where we actually dwell now into the position statement that we'll submit as part of the statements coming from different stakeholders to feed into this UNGA high-level meeting on AMR in September this year. Thank you so much.
Thank you so much, Julian, for that very informative presentation about the UN General Assembly high-level meeting on AMR. I believe that we now have an understanding as to what this meeting is and why it's very significant for us to actually participate. At this juncture, as we've heard, this position statement, which was developed, the development was led by 14 youth-led organizations with support of REACT, and they are part of the African Youth AMR Alliance Task Force. So I'll invite the chairperson for the task force, Mayowa, to share more about the task force so that we know about what this task force is, and if we also, if you want to join, what's the process, what the task force is involved in, and then after that, we'll then head over to the position statement and hear a bit about the position statement. I'll also be sharing a link in the chat where we can view the position statement. So it exists in both English and French versions. So yeah, you can, in case maybe you're fluent in French, you can you can read the French version. In case it's English, then you can use the English one. So thank you so much, and over to you, Mayowa. And thank you. Let me share the presentation.
Yeah, thank you very much, Danielle. Thank you very much, Daniel. I believe I'm audible now.
Yes, we can hear you now.
Yeah, thank you very much. Firstly, I would like to appreciate the speakers that went before me, the Professor Marfin, as well as the Deputy Director for REACT Africa. REACT Africa has been a very supportive backbone for the work we're doing at the African Youth AMR Alliance Task Force. So my name is Mayowa Akinpelu. I am the chairperson for the IR Task Force, the African Youth AMR Alliance Task Force. And I also represent the African Public Health Student Network within the task force as a member organization for this task force. Today would just be my presentation would solely be focused on the story leading up to the African Youth Position Statement. How did we get there? What is the African Youth AMR Alliance Task Force? I would also be shedding light on why we were established. Basically, the African Youth AMR Alliance Task Force was established to unlock African youth action for the AMR pandemic, and to be a constructive representative voice for young Africans in decision-making cons. Yeah, you can move to the next. Thank you. So the African Youth AMR Alliance Task Force was actually launched earlier in March this year. That's to tell you how very close it was that we just established this institution, this respectable and representative institution of young people. So, there's a saying that you should never let a good crisis go to war. That is actually the driving force for us. There's a crisis at hand, which is the AMR pandemic, which is ravaging through the global space, and primarily having a much more indenting impact on the African continent. And so we felt, what is the best way for us as young people to come together and put together our collective will, our collective drive for this change and for action, and to be part of decision making. So a consortium of 14 organizations together to form this African Youth AMR membership from these different organizations. We are about 600 in number. That's if you are accumulating the collective membership of each of the member organizations in Nairobi, Kenya, supported by REACT Africa, who also sits when we are on our advisory board as part of the supportive backbone and idea driving some of the actions which will be carrying out at the task force level. You can move to Daniel. You can go to the next. Our mission, I think I should highlight our mission. Daniel, just go back, please. The slide is slower than my voice, than my connection, so I'm trying to make sure. Can you go back to the earlier one?
I have. Can you see it now?
Yeah, thank you. Yeah, I can. So our mission as African Youth AMR
Hello, Mayo. I think we lost you for a minute there. Maybe Lucy, can you hear Mayo? Just confirm.
No, I think we lost him, Daniel. Thank you.
Maybe as we wait for Mayo, maybe Lucy, would you mind just taking us through, just that we're able to save on time?
Okay, thank you. Our mission is to have a united youth alliance that is the leading charge against AMR. We are forging a future where every individual thrives in a world from the threat of AMR. That is our vision, where we are envisioning a future where every individual in the world will be free from the threat of antimicrobial resistance. Next. That is the structure of the IR task force, whereby we have the honorary council, the executive member, where most of the panelists sit in, and the representatives of the 14 organizations that were present on the launching of the task force. We have the advisory board, where React Africa sits, and also we are looking forward to onboarding other organizations who will be in the advisory board. And also we have the working groups. In the working groups, we have different categories, and we shall be onboarding other youth-led organizations to assist in the different categories. Next. The progress so far is that we are currently developing operational structures and our annual work plan, and we shall be having it out. We are also organizing collaborative pilot projects, whereby we are looking for potential sponsors for our projects on AMR. We are developing also a strategic plan. We have plans to onboard other organizations once the structures have been finalized. So we'd also wish to have you guys who are in youth-led organizations to check out our page on LinkedIn and on X, because we shall be sending out the link to onboard other organizations soon. We also have plans to onboard strategic partners to the task force, and if you sit in any of the strategic partners, for example, the WHO, FAO, World Organization for Animal Health, we would appreciate too if you can give us a word out there, a good word out there. Thank you. Next. The UN National Assembly meeting, high-level meeting on AMR, will be happening on September 26, 2024. Julian has given a brief overview about it and what concerns the UN high-level meeting. I can see Mayowa is back. Maybe he can take over. Thank you.
if he's in a position to do so, maybe I can continue. Hello, Maya. Sorry about the
Yeah,
inconvenience.
I'm sorry about the network with just Nigerian electricity. I don't know if you can continue. I think you can just have me just go. Thank you.
Okay, thank you, Mr. Chair. There will be we are hoping there will be a side event whereby they provide head of government and state government ministers and political leaders, whereby they give out their views on the antimicrobial resistance. This is also an opportunity to discuss effective approaches on addressing AMR at a local, national, and global level in relation to funding, policy development, and multi-sectorial collaboration. Julian has given a lot on the UNGA high-level meeting and on AMR and why it is timely for us to be doing this, and also it's a chance for us to get the recognition and also to voice our ideas as African youths and to be included in it. The last high-level meeting was held in 2016, as it has been stated by Julian. Thank you. Next. So what about our African Youth Position Statement on Antimicrobial Resistance? We realized that there is need for meaningful youth participation in governance and in policy making structures. We are aware and have the skills to do this, and we need to be recognized and participate in these UNGA high-level meeting. There is need to also have the youth voices represented in the UNGA on AMR. There is need for the African priorities addressed in the UNGA high-level meeting by Africans. We understand our own issues and we believe we are better placed to talk about our issues, and we also have the solutions. Currently, we have the African Youth Position Statement on AMR, and it was developed through a consultative process with different youth-led organizations, and it is available in the English and French versions. You can check it out on the React Youth Engagement. You can endorse, you can share it, you can send a good voice out there to your networks to endorse so that it can reach the UNGA high-level meeting. Next. Thank you so much for listening. That is our position paper. We are going to have the panelists talk about give an overview of some of the objectives that we need to get engaged in.
Okay, thank you. Thank you so much, Lucy, for that introduction. So currently we can just check the chat. I've just shared the link to where you can access the position paper. So you can just check the chat currently. So you can have the PDF form of the paper both in French and in English version. So at this juncture, we'll then proceed over to the position paper itself, and we'll be looking at, what are some of the different areas, what does it address, and just to have an overview of it. And we'll have different panelists sharing different areas of the paper. So I'll invite Naomi. Naomi is a co-founder of the AAA, that is Alliance Against Antimicrobial Resistance, Alliance Against Antimicrobial Resistance, an organization based in Nigeria, working the entire Africa, and she's also an executive member of the task force. So just a minute I share, then we can have a look at it. Thank you. So that's the English version for the paper. So Naomi will take us through the first key recommendations, which is youth participation. So maybe Naomi, over to you. Thank you.
Hello.
You're breaking a bit, Naomi. Hello.
Can you hear me?
You're breaking a bit. Maybe you can stop sharing your video. We see whether the bandwidth will improve. Okay.
Is it better?
Yes, no, it's better. Thank you. Can go ahead.
Okay. Okay. Hello, everyone. My name is Naomi Tuesday. I am an executive board member of the task force and the co-founder of Alliance Against Antimicrobial Resistance, also known as AAA. So I'll be talking about youth participation as one of the points we majored on in this position statement. At the task force, while crafting this position statement, we acknowledge that youth are among the generations most threatened by antimicrobial resistance. We also recognize the importance youth play in raising awareness and innovative solutions, and the need to take into account the lived experiences of youth to engage, to encourage inclusivity. So that was why youth participation was like a major pointer in this position paper. Youth bring ideas and fresh perspectives to the table, which is very essential for developing new approaches to combating antimicrobial resistance. I mean, antimicrobial resistance is a major public health issue, and investing in youth participation ensures the long-term sustainability of efforts to combat antimicrobial resistance by instilling proper antibiotic stewardship practices even from an early age. So through this position statement, it's a call for policymakers, private and public organizations, civil society, youth, and other stakeholders to encourage the inclusion of youth in all processes and antimicrobial resistance advocacy. This would be an example, or examples would be by incorporating youth advisory councils, having youth delegates involved in crucial meetings, like the UNGA high-level meeting that's coming up in September, and suppressing any stereotypes associated with youth engagement, making sure that engagement with the youth is not just surface level, but it's also in-depth. Youth are carried along in every process of decision making, and also facilitating accessible funds to support this. So by implementing these measures, we can empower youth to actively contribute to combating antimicrobial resistance. Thank you.
Thank you so much. Naomi, maybe over to you, Lucy.
Thank you, Daniel. My name is Lucy Gatitu. I'm a veterinary student at the University of Nairobi. I also sit in the task force as the Secretary General. I'll be taking you through the sustainable action objective. And the call to action, as emphasized, it is important, its importance emphasizes on a multifaceted, sustainable approach to addressing antimicrobial resistance. It recognizes the socioeconomic dimensions of antimicrobial resistance, and particularly in the African continent, and the threat it poses to SDG 1, which is the poverty reduction and progress towards sustainable development. This document acknowledges the impact of AMR on food security and nutrition, which is an SDG 2, the SDG 3 on human health management, and the role of clean water, sanitation, and hygiene facilities, which is part of the SDG 6 in propagating AMR. It also highlights the importance of education and responsible antimicrobial use in relation to the SDG 12. The call to action emphasizes the need for international cooperation, global partnership, and multi-stakeholder collaboration, including youth networks, to address antimicrobial resistance. It outlines several key actions for parties to take. And the first one is establishing a pragmatic targets for antimicrobial resistance intervention within the framework of the SDGs. The second one is strengthening financial and social protection strategies to allow equitable and affordable access to effective antimicrobials. Enhancing investments in sustainable food production to reduce the need for antimicrobials in agri-food systems. Providing equitable access to primary healthcare services and strengthening the implementation of national action plans in different countries. Strengthening access to functional water, hygiene and sanitation, that is WASH infrastructure, and waste management system, coming up with policies on waste management systems and that should be implemented. Developing national action policies and guidelines for pharmaceuticals and healthcare waste management. Ensuring comprehensive and universal antimicrobial resistance education, supporting communities antimicrobial stewardship, and strengthening mutual partnership between these communities and the relevant government agencies, like a trickle-down of information reaching out to the grassroots. Promoting a One Health approach through collaborative partnerships. In conclusion, this call to action provides a comprehensive roadmap for sustainable action towards antimicrobial resistance mitigation, emphasizing the importance of a multi-sectorial, globally coordinated approach. Thank you. Over to you, Daniel.
Thank you so much, Lucy. Before we proceed, there is a Mentimeter link that has just been shared by a chat. So guys, as we also continue hearing more about the position paper, we can just click in there and just respond to the different questions. Please feel free to, either you can share as anonymous or you can write your details, then at least we'll also project that towards the end of the webinar. So guys, please click onto the Mentimeter link and please just respond to the questions. In case you have any difficulties in doing that, you can share in the chat, then we will assist you. Thanks so much. So at this point, I'll invite Brian to talk about the other key area that the position paper talks about. Over, Brian.
Thank you, Daniel. I'm Brian Onditi. I hope you can hear me.
Yes, we can hear you, Brian. If you can start by introducing yourself, if you don't mind.
It's okay. I'm Brian Onditi, medical psychologist and also the founder of Snowman Atlant. I'm an executive member of the IARA task force. And yeah, I'll be here to take us through the global accountability framework stated in the document that we are presenting to us evening. Recognizes that antimicrobials are used. The impact of AMR, no borders. That means it's a global phenomenon, and we should come together to handle it. So the document acknowledges that addressing AMR requires multidisciplinary action and by different organizations, governments, everyone, globally, locally. I mean, it's affecting everyone, and everyone should be part of the solution. It's also emphasizing that antimicrobials are common good to humans for the benefit of human, animals, and the environment. That's the One Health that we've been hearing about. Sorry, I'm somewhere in Africa where internet is an issue. I don't know if you guys can hear me still.
Yes, Brian, we can hear you. Go ahead.
Okay. Yes. So the paper also emphasizes that that AMR is among the top world's most serious public health threats, of course, among others. So we call on the parties, we call on everyone, the governments, the organizations, civil societies, individuals, youth networks, and everyone to ensure that AMR is included in the scope of IHR instruments on pandemic prevention, preparedness and response. We also call on the parties to strengthen national capacity for AMR surveillance, to monitor, detect, and share data on drug-resistant microorganisms. These from bacteria, fungi, viruses, and parasites, leaving nothing untouched. We also call on the parties to ensure international cooperation towards equitable access to vaccines, diagnostic tools, antimicrobials, and other other countermeasures. This one was informed by the fact that we realized that most low-income countries and medium-income countries lack diagnostic tools, so they can't probably obtain and share data on AMR. Yes, we also call on parties to ensure monitored progress and evidence-led planning based on gaps identified through global tools such as the quadripartite annual tripartite AMR county self-assessment survey on IHR's joint external evaluation. So this was informed by the task force meeting earlier in March, where we realized and recognized that AMR respects no borders.
We are losing you.
Also, the affect in every continent. Yeah, I think I'm back. Yeah, my internet. Yeah, so just to finish, we recommend, we suggest that ownership of responsibilities be outlined on the framework. Yes, and also plans laid for information gathering, monitoring, and reporting globally. Every country, every continent, all regions. Thank you.
Thanks so much, Brian. Then we can go to the last part where we'll hear from Hafiz. So over to you, Hafiz. If you're there, you can hear us.
All right.
Just through the financing aspect.
Thank you so much. Thank you so much, Daniel, and thank you so much to all the hosts as well. My name is Hafiz Hamza. I'm the AMR Youth Program Liaison Officer at Dusit Blue Foundation and a proud member of the executive board at. Today, I'll be talking you through the financing topic of the position statement. And just to give you a little bit of a background information and a bit of an overview and context into what we're discussing, financing is at the core of any initiative, project, or endeavor that we want to undertake. And when it comes to combating antimicrobial resistance, the importance of financing cannot be overstated. We need sustainable financing and investment in AMR response to support country-level implementation. Because without a commitment to continuous and sustained financing, we will struggle to keep up with the microbe. So adequate financing is very essential.
Hello, Hafiz. We lost you a bit. Can you hear us? Hello, Hafiz. Maybe Lucy, can you hear Hafiz?
I think we.
Okay.
So, Daniel, I think we have lost Hafiz.
Okay. Yeah, so, okay.
Share?
Yeah, so maybe because of time, maybe Maya, would you mind just finishing us off in this last part of the position paper?
And so our recommendation is on financing. We know most of the bottlenecks that we face in terms of addressing the issues relating to antimicrobial resistance has very keen alliance with the lack of finance. So we at the task force, through our collective input from young people across the continent, actually came together and tried to recommend areas and ways for us to actually mobilize funds for addressing antimicrobial resistance. And we looked at what the major issues here in Africa are. One of them is the lack of domestic finance for addressing health generally, not to even talk of the issue of addressing antimicrobial resistance. So our call with this position statement is to try to seek that our leaders, our political leaders, increase the political will to actually address AMR by increasing the percentage of the budget that actually goes to addressing antimicrobial resistance and health generally. If you can draw your mind back to the Abuja Declaration of 2001, where we had a collective, a collective will by governments to input 15% of the budget within various countries to health. We know this commitment has not been met. So with this position statement, what we are saying is that we need our political leaders to see AMR as a priority issues that need to be tackled, and a priority issue that also need to be financed, because this is a condition where when we are unable to treat most of the infectious diseases, it won't just have an health implication, it will also have socio-economic ramifications as well. Also, we, through this position statement, called for much more intermediary funding to upscale activities on AMR. And this funding should also be accessible to primarily African countries, because we know here in the continent, we are actually facing the heavy backlash and the heavy whip of the effect of antimicrobial. So those are our key call through the position. Call for youth participation, the call for sustainable action. And what we are saying here to all of us is to also be part of this discussion, be part of change, and to be part of this action, which is leading. And the platform is for everyone to join, and the the endorsement for this. Make sure that this document gets to the right. Use that as an opportunity to amplify your voice and our voice, and to ensure that our future is not at stake. AMR generally. So thank you very much. Those are the position statement, and we are sorry for the connectivity. Advocating for at the IR task force to ensure that our government also electricity and connectivity as well. So thank you. It's a pleasure, Daniel, for this well-moderated event. Thank you very much.
Thank you so much, Mayo, for that. We really do appreciate, and thank you, everyone. So we'll once more share the link to the paper where you can access the task force. Where you can access the position statement. So just check on the chat box right now. We'll also share it as we send an general email to everyone who attended today. So that's where you can find the PDF version, as I've shared, both in French or also in English. Then at this point, it's an opportunity now for each one of us to share our voices out of what has been addressed. There might be some things that you feel maybe have not been addressed. So this is an opportunity for each one of us to share. So I'm sharing a Mentimeter link right now, and then our deputy director Julian will just project what we'll share towards the end. So I invite each one of us. You can just check the general chat right now. The Mentimeter is there, so please feel free to answer the questions that are there, just so that at least we're able to capture everyone's view, especially if you are not able to participate in the earlier consultative process that was held. So I'll just give each one of us a minute just to do that. So please, let's do that now. So in case you have challenges accessing the Mentimeter link, in case you have any challenge responding to the different questions shared, please feel free to just raise your hand or just type in the chat box. Then we'll assist you on the same. Yeah. As we do so, maybe we can address some of the questions in the Q&A just to save on time. As we all respond to the Mentimeter. So there was a question in terms of Ivory Coast and Ethiopia, where they're not in the list of countries. So maybe that question is a bit unclear. So maybe it was shared anonymously. So in case you would love to maybe rephrase the question and maybe ask it, maybe offer some clarity to it, we would really appreciate that at least we're able to address it in a better way. And I also encourage each one of us to just check the Q&A session. So there are quite a number of questions that have been asked, and the response has been shared in the Q&A. So you can also check Q&A. Maybe you might have a similar question with someone else, or maybe the question could also offer some insights in terms of some area you might not have thought of. So in case you ask that, but the task force, the key aim, so it's just beginning, and the goal is to have all youth-led organizations within the African continent actually onboarded in the task force, voluntarily, those that are willing. And the focus is to target all countries within the African continent. And we are very specific. If you check even the documents that the task force is developing, even the communication that is shared, we consider we've been very sensitive in terms of ensuring that, we address both the Anglophone and the Francophone regions. That's why even the documents, for example, the position statement are also in French. For this website, for this webinar, for future ones, maybe we will try also and have like a translator so that at least we're able to cater for the French Francophone countries. And also, we're also working towards incorporating the Lusophone countries too, so that at least, we can also have them on board, and any other. So those are the three main languages, so that at least we have a holistic approach to this. There's another question which was asked by Peter. How are we tackling, or what strategies have we put on place to combat misuse of antibiotic in animals, which is a huge catalyst in human health? I believe there's a lot of work going on in the animal health, but I would like to give an expert in that field, maybe Lucy. You can share a bit on that, if you don't mind, maybe some of the work that is ongoing in the animal health area in terms of mitigating AMR. And as Lucy responds, let's continue sharing the touch box, and then our Deputy Director, Julian, will then maybe share a bit on some of the responses that are coming in. So thank you, and over to you, Lucy.
Thank you, Daniel, and thank you, Dr. Peter, for the good question. Currently, there are some countries that have joined in having a One Health approach for combating the misuse of antibiotics. There are also strategies that have been put in place by different countries and different pharmaceutical industries on when not to use, how to use antibiotics. There are labs which have been there are labs which are doing the antimicrobial sensitivity testing in some countries, which is affordable. I know there is one that was set up in Zimbabwe. There's some work ongoing on antibiotics in animals. There is also the Reno farm that is being supported by FAO. There's so many activities that are ongoing on antibiotic use in animals. And maybe you can check out the Reno farm on FAO page. Thank you.
Thank you so much, Lucy. So when you visit I still encourage us. I see most of us haven't clicked yet on the Mentimeter. I'll share it once more. Please, guys, we want to hear your views, so please just participate. It's something very easy, maybe just 1 minute or 2 minutes. You'll have responded the questions and just in summary. So we can contribute. So let me share it again. That at least we can all respond to it. And as we do so, I would want to invite each one of us. So the idea of having the position paper is that we have a lot of many youth-led organizations actually reading through it, and everyone else actually leading through it. And to in terms of ensuring that it has the right support, it is it gets to the intended platform, that is the UN General High-Level Meeting on AMR, so that the youth priorities and African priorities are addressed. So we have a call for endorsement. So once you visit the website where it is housed, the task force website is also coming up and will soon be published very soon, and it will also be shared there. But for now, we have it. We have the position paper in the React website, so you can just visit and endorse. And for everyone else, maybe you can share with friends to endorse the paper if you read it and you see this is something that you you align with. And also, it's also important that we also share it with our organizations and also encourage endorsements. So there are two ways of endorsing. You can endorse as an individual, or you can also endorse as an organization. So far, we have had almost 25 youth-led organizations endorsing it, which is quite good, almost to 30 right now. But we would love to have more, especially from the African continent, so that at least if there are so many different organizations that endorse it, then when it is delivered, then the UNG it will have some good weight, and there'll be some it will actually be taken seriously, so that our issues as young people are addressed. So there's a request for the code for Mentimeter. Maybe Julian, you can maybe share that in the chat if you don't mind. Yeah. So with that, we like now to so you don't have to have a code, Nelson. So just click on the link. Once you click on the link, you'll be able to access the questions directly. So the code is not really necessary. So we'll just extend for a few minutes, maybe just 5 minutes, because we're almost done. And at this point, I'll just like to hand it over to Julian. You can just take us through some of the responses that have been coming in, and then maybe we can respond after that. We can maybe wind it off. So thank you, guys. Please feel free to share about the position paper, and feel free to participate in the Mentimeter, so that we're also able to collect your views. Thank you. Over, Julian.
Thank you. Thank you so much, Daniel, and thanks to all the panelists for really summarizing this very well. And I think there was also one question that was speaking to how people can join, if they would want to join this task force. So I think Lucy alluded to it earlier, that it will be shared. And I think it would be good to also share how this is done through also the emails as we share the recordings, so that whatever organizations would want to join are also clear as to how the process goes. But the objective is to have as many youth-led organizations as possible joining. And in the same light, speaking particularly for this position statement for ONGA, it will be very important for as many of us as individuals, as organizations to endorse it, so that the more diverse the responses or the people who are actually signing and endorsing it, I think the better it is strengthened in terms of now these are what the youth in Africa are saying. This is what they would want to see. So thank you so much for elaborating the different sections in a very good way to the panelists. And I don't know whether there are any additional questions that have not been responded to. If not, then I think I can just see what's in the Mentimeter now. Let me just see if there's some, yeah, because sometimes it's always good to also share that so that you'll be able to see what responses came out there. So I don't know whether you see my screen now.
Yes, it's visible, Julian.
Great. So the first question, this is just to make it quite interactive and to just hear what your thoughts are, whether you think governments are doing enough to address antimicrobial resistance. And from the 32 responses that have come, you'll see that most actually feel that the governments are not doing enough. This I would assume, of course, in our continent, in the African region is where we are really responding to. And I think I would agree with it actually to say there is more that can be done, as we saw even from some of the recommendations that are coming from the position statement. And it's good that as youth, you are actually realizing this now. So as you transition, maybe some of you now into being policymakers, and if not, how do you advocate? How do you influence policy to ensure that at least there is a change in it? I think there was mention from Manyoa that even just the commitments that governments were mandated to at least have 15% of their budget focusing on health, that has not been possible even to date. Even as we come to the realization of the Sustainable Development Goal number 3 that actually looks at health, you'll notice that there are a lot of gaps still. Where domestic financing, there are a lot of challenges that are happening in the country. So really, it shows that even this group appreciates that I think more can be done by the governments and not necessarily. I think one of the things that has actually spoiled us in the African region is being reliant on foreign financing coming through, and which sometimes resources are not used efficiently and effectively. So what can we do as the young leaders coming up to make sure that governments are doing at least more in the AMR space? That's a challenge that we all have, because we are the future leaders and we need to know that anyway, you're current leaders with just a bit more time, not even future leaders. So yeah, that's what that question was saying. The role of the youth, we do have 51 responses on this one. And awareness, advocacy, engagement seems to be what is coming up very strongly. And indeed, in agreement with that, we also have research, very important. Why don't we all, if we are doing these, if whatever course you're doing, because AMR is indeed multi-sectorial, how can we have the thesis that we are doing or the dissertations we are doing in our academic life at least focus on AMR? It actually contributes to research. There are some youth leaders that have been very keen researchers who have published a lot of papers, even as young as they are, trying to contribute to the body of knowledge in Africa. So I see research is actually featuring quite a lot, but awareness definitely coming up as one of the very major roles that young people can do. You guys are key gatekeepers to the communities. You can be able to actually share your knowledge with your fellow peers. You can then share with your families. Just simple, messages, just like ensure that you adhere to your prescriptions, go to the medical facility if you're not feeling well, do not self-prescribe. In the agricultural sector, most of us are farmers in Africa, and at least trying to share them simple messaging, just like the utilization of these antimicrobials indiscriminately for growth promotion is not a good thing to do. And whatever we do in our small little way will be able to contribute to actually raising awareness. Yeah, so I think these are some of the interesting, so it's good. I also see monitoring, commitment. I see governance coming there, driving awareness, the future, voice out ideas. So yeah, it's good to know what is coming out from the different responses here. So we do have 27 responses. I won't go through these, of course. We'll also share this so that you just know what has been coming up. And I think the executive team of this task force can also look at this critically to just see some of what is coming here, reach to the grassroots with AMR messaging, deliver smart, achievable targets, very important, because without measurable and especially smart targets, it will be very difficult now to, how realistic are we being? I think countries, one of the major feedbacks that has come is to say, how do we make these targets relatable to different contexts? Because it can be very difficult. So from UNGA, one of the key asks, I think, from different stakeholders this year has been to say, how do we come up with smart targets? How do we come up with indicators that relate to actual challenges that we are seeing on ground? So it's good to see this coming. As Daniel said, we'll keep this open so that if you have any feedback that you would want to put even after this call, you'll be able to do this and we can then close it out end of day on Monday. What is the major area you'd want addressed during the UNGA high-level meeting on AMR? Financing comes first, and it's actually a very key thing that even the Global Leaders Group came up with, as you saw in one of the slides that I have presented. I also see the infection control, very important, because prevention, sometimes we focus more on the control, and yet not focusing on the prevention measures. Because you saw what happened with COVID, it's actually possible to increase, say, to actually improve hand hygiene, even in the African continent where we have challenges with water and sanitation. But during COVID, I'm sure you will agree with me that we saw a lot of improvements around just the basic hand hygiene. So how do we also look at prevention measures, including vaccination as well, and such other focus areas we can use to actually mitigate this global health threat. So I see financing coming out strong, policy issues, human health, resource allocation, the role of the whole health worker, very important as well, because from the work we have been doing, we have realized that some of the health workers are not even aware of antimicrobial resistance. Some of the feedback we get is that even the youth themselves feel that the curriculum in their institutions does not adequately cover antimicrobial resistance. So those are some of the changes that should happen even at the national level as policies are being changed so that at least we have AMR being covered quite well in the, so that as people transition to the being the health workers, as this one of the feedbacks is saying role of the health workers, resource mobilization, youth and AMR, capacity building, and all that. Yeah, so good responses coming here. I think that's the end of that. So I think from my end, I don't have anything else. I'll hand back to you, Daniel, to close the session. And I'll just reiterate the sincere thanks to everyone who managed to participate in this session. And also thanks to our panelists again for the excellent presentations. And this is only the beginning. So how now do we ensure that these voices now come through? One of the things we are going to do is to ensure that this position paper is also presented at the multi-stakeholder meeting that's happening on the 15th of May, later this month, through the multi-stakeholder partnership platform, so that it will be one of the documents that are presented as well to the different stakeholders, and so that at least the voice of the youth is actually put in. And we'll also continue to look at ways of how to ensure that at least this feeds in, as this is a timely moment, as now different stakeholders are coming together and consolidating different voices. So I encourage you to endorse and sign this position paper if you have not done so already. Over to you, Daniel. Thank you.
Thank you so much, Julian, for taking us through that. Thank you, everyone, also who participated in the Mentimeter. We appreciate it. Always good when you give feedback so that we see what the general feel of everyone is. I might think this is what the youth want, but that's not what comes out. So when Paul called upon, please always feel free to share feedback. And at this juncture, I think we've come to the end of the session. So maybe I don't know whether Nahashon or Michelle, you have something as we continue. So Nahashon and Michelle have been the ones who have been quite busy in terms of responding to most of our questions. They have been coordinating behind the scenes. So Nahashon, anything from you as we wind up?
Okay. Good evening. First is to thank everyone who has attended this particular webinar. We are very grateful for you to come. It couldn't have been successful without you on board. And also to my colleagues, the panelists, you have been great. Thank you also for the work that we have been doing. To all of us youths, let's continue working very hard and also contributing to the AMR response. Let's be innovative. Let's come out. Let's not shy to offer the knowledge and the information that we have. Talk to one another. We can do great even as individuals when it comes to AMR. There are so many enabling factors that are there, the socioeconomic factors that are driving AMR, WASH-related factors, IPC. I know we are knowledgeable and we have the information. Let's do what we can first as individuals, even as we move on to the next level, to engage our colleagues, to work as organizations, and also to play the advocacy roles, reaching out to the government and other multinationals. Let's continue working hard, and I know together we are a force to reckon with. Thank you very much.
Thank you. Thanks so much, Nahashon, and thank you. I don't see Michelle. Maybe Michelle, are you here? Anyway, so with that, guys, thanks so much for joining in. We really do appreciate the numbers were really amazing. And thank you for everyone who has stayed until now. It's almost 1 hour, 45 minutes. We don't take that for granted. We are really thankful for, for you joining, for you listening, for you sharing, your feedback. We do appreciate. Once more, we call on each one of you. Please let us let us endorse the task force, both as individuals and as an organization, so that this time we have quite some good representation for our African continent. At times, currently, if you look even at the funding scope for, from the global context, some of the priorities for Africa are not really addressed. So it's upon us to really raise our voices and be at the table. We say, if you're not at the table, then you're at the menu. So let's be at the table and let's not be the menu this time. So that at least most of our areas are addressed. I also want to thank our Deputy Director Julian. Thank you also for being with us all through. I know it's quite a busy time for you, and also Professor Muffin in absentia. Thank you also for joining us and listening to the young people share their ideas, and also we do appreciate having you. And to the task force colleagues, thank you for joining in. To our panelists, thank you so much for sharing, and to our coordinators behind the scenes, thank you everyone for that coordination. And so the presentations will be shared via email. We'll have like a response email, and therein we'll also share the Mentimeter link, and we'll also share the link to the to the position statement where you can also access it. And we encourage you, once this is shared, don't just stay with it alone. Please share with other colleagues in your circle, maybe who might not have heard of this webinar, but can also gain a lot from it. So thank you everyone for joining in today. We appreciate. Let's spread the word. Let's spread the word. Let's share the position paper among different young people out there, so that at least our voices are heard. When we work together, we really be able to amplify our voices. And with that, I would like to bring us to the end of the session. I see there's a question. So currently, the position paper exists in both French and English version. That's what we're able to do for now. But with time we'll be able maybe to translate other documents to other languages. But now we are looking at those, because those are the two dominant languages in Kenya, and it's also a working process. There's also a process of onboarding other youth-led organizations. Currently, it's just that some structures are being set up so that at least once everyone is brought on board, there's a clear way to operate, and we can all engage in a sustainable manner. And information in terms of how to join and you know, how to also be part of the task force, and in case different roles that we as individual we can play in our individual capacity in the task force. This will also be communicated. So please also follow the social media handles for the task force. Maybe Mayo can just drop them there as we complete some links, and this will also be shared also via email there, so that at least you can be able to follow up on the different communications that are shared by the task force. And yeah, with that, we come to the end of the session. Thank you so much, everyone, for joining. We really do appreciate, and we wish you a wonderful weekend, and we hope that we'll be able to carry all of us together. So thank you, everyone, and do have a wonderful evening, and bye-bye.